the amalgam restoration, which is the silver restoration. Not so popular these days, however, still used in a lot of dental offices, so it's better to have the information and not use it than not have it and need it, okay? All right, we are on a roll. Guess what we need first? Protective eyewear, you got it. Then we need to protect the clothing by putting the bib on the patient. And then we need high-speed handpiece to prepare the tooth, just as we would do for a composite. We would also still use the caries indicator to make sure that all the decay was removed. But here is where the main difference comes in. The material, the amalgam, is stored in this capsule. And this capsule has to be squeezed in. And when you squeeze it in, the two compartments that are separated in the capsule combine. And then you shake it in an amalgamator. I showed you that the last time. And it allows the two segments, the powder and the liquid inside here, to mix and become one smooth amalgam. And then I'm going to take out these amalgam instruments to show you. Once you have shaken this up, you open it out and pour the contents into this amalgam well, okay? And then we use the amalgam carrier to pick up the stuff we put in the well. This is what you do as the assistant. Hand it to the doctor, and the doctor squeezes that stuff out into the tooth and then has to pack it in. So whereas with the composite, we put it in and use the light to cure it, the amalgam does not use a light. We pack that instrument, use this packing instrument to secure it in that tooth. And once we've done that, we shape it with a burnisher. Okay? And then we remove the excess with a carver. Okay? And between the carver and the burnisher, we keep working until it's just right. And then guess what we use again? We use this, what? Articulating paper to check the bite. Now, one thing I want to show you is that we never just use our fingers to put that in the mouth. We have a holder that grips it. And this is what you would hand to the doctor for the patient to bite on to check the bite. Okay? So we've gone through sealant, we've gone through composite, and we've gone through amalgam. Now, for the amalgam setup, what I did not speak about was the topical anesthetic and the syringe and the needles, but that would be used for this setup as well. Since we reviewed it before, I chose not to complicate things anymore. But you knew the sealant, which is a preventable application on teeth to prevent tooth decay. And then we spoke about two types of filling materials, the composite resin and the amalgam. The amalgam is a silver filling and it's packed in and it is left to harden, whereas the composite is hardened by a curing light. Okay, that is all I have for you today. You are a dental assistant in the making.